Hello everyone, my name is Merlin Theodore. I'm a dental hygienist. I'm married and I have 3 kids. I have been practicing dental hygienist for almost 8 years, and I find out that most people don't know how to brush and floss. So it come in mind that I want to help everybody who's watching my video to learn how to brush and floss. That's why I'm uploading that first video. So I'm gonna do the flossing first so that everybody can have a pretty good idea how to floss. And then after that follow up, I will do some other video on brushing, and we can also talk about some periodontal disease that is very high in the adult population, so that I can help everybody understand and teach their kids how to do a better job so that they don't end up having periodontal disease at very early age, because we find it also on very young people like teenagers. And that's the leading cause of tooth loss. So I want to help everybody who is listening to that video. So I have my floss. You can use any type of floss that you want. They have some little floss that has handle. It's all about the technique. It's not about what type of floss you use. It's all about the technique. So when you're flossing, if you're using that string, you want it to be as long as your hand, so that you can take a clean piece for each tooth that you're flossing. So you wrap it around one finger, the middle finger, on each hand. You wrap moss on your right hand if you're right-handed, or on your left hand if you're left-handed. So you leave a little bit. As you go in, you keep getting a clean spot each time. So when you're doing flossing for the back teeth, you want it as long as your finger can reach all the way to the back. So I'm gonna demonstrate on myself so that everybody can see how to do it in themselves also. So I have that floss, so I'm gonna go all the way back. So I floss all the way back where there's no teeth between the gum and the last tooth that you have. If you have your third molars, it might be a little bit difficult to reach all the way back, but if you have second molars, it's much easier. So when you go in between the teeth, you have to floss twice. Then I get a clean spot. Reason why I get a clean spot, because each in between that you're gonna see some stuff, depending on what you eat. Then you get a clean spot to go to the next one. You go as deep as you can until the floss stops. The reason why, because you're flossing for the gum tissue. You're not flossing for the teeth. You're flossing for the gum so that the gum can be healthy. When you're flossing, if you have not been doing that, my gum does not bleed because I know how to floss, and I floss every night, so my gum does not bleed. You don't see any bleeding as I'm doing it. But if you have not been doing it, or you don't floss the way you're supposed to, or you never floss at all, your gum gonna bleed. But it's okay if your gum bleed. Do not stop doing it because your gum bleed, because as you flossing, it's removing the infection, the inflammation in your gum. That's why the gum bleed. So as you keep doing it every day, the blood gonna be less, and your gum gonna get more healthy every day. It's very important that you are flossing every night. Before you brush, you floss, and then you brush, then you go to bed. You don't want to floss and after that you eat something and go to bed. It's like you didn't really do anything. Reason why I keep stopping, so that, because when I'm doing the flossing, I don't think I can talk. People will not be listening to what I'm saying. So I stop every time, because flossing, as you floss, you have to make sure you make a C shape when you get in between the teeth. You make a C shape, you floss one side of the tooth, then you floss the next side of the tooth. That's the proper way to brush. And you have to do it for every single in-between teeth. Even if the teeth are not tight to each other, like my front teeth, you still floss. Reason why? Because you want to clean around the gum tissue to make sure that there is no food that is left. Because the space around your gum that attach your teeth together. So that space, every time you eat, food stuck around your gum. That's the reason why it's really important that you are flossing, just to help the gum to stay clean, so that you're not attracting any bacteria, because you have good bacteria in your mouth and you have bad bacteria. So when you're not doing a good job with brushing and flossing, so you give the bad bacteria a chance to take over the good one. And when you do that, now it's disease. It's either you have gum disease, you have like gingivitis, which is inflammation in the gum. This one is not too bad, but when you have gum disease or periodontal disease, this one is pretty advanced, because you have now infection in your mouth and it's pretty silent. So it's very important that you really take good care of your mouth. As we go along, we can talk about more stuff that are related to your body and your mouth. So today, I really want to do a quick video, talk about, the flossing, and next time we can talk about brushing and other stuff. So thank you. Have a wonderful day or afternoon whenever you're watching it, and have a blessed day.